Hello and welcome to Time of Death. I'm your host Dee.
And I'm your host Ris.
And together we are Time of Death.
And together,
till death do us part.
Till death do us part.
So this week I have an interesting case. I'm actually doing it. And what number is this, Ris?
39.
Back on my odds.
Oh my god, and we're almost at the good old 40. So if you are new here, welcome to the party. We gather every Wednesday to do an episode of Time of Death, and we are two nurses who are also sisters, by the way, if you didn't know already. And we like to talk true crime. We like to focus on cases that have a heavy medical influence to them, or cases that feature a medical professional as the perpetrator or the victim. So, Dee,
I like the ad-libs.
Take us home.
I love the ad-libs this time. It was a little deviating from your normal spiel, so I like it.
I wanted to, add a little sparkle.
Pizzazz.
Just a little bit of sparkle.
Little bit of, what is that? There's a meme. Little bit of jazz. What is the meme?
Add a little bit of spice.
That's it. That's it. Spice. Spice. All right. So I'm going to be very serious throughout this podcast episode because we're going to be talking about some real issues that are going on. So my normal goofy little self is I'm being very serious. So bear with me.
Hold your horses. She's not goofy tonight.
No, I'm serious tonight.
Okay.
I'm being very serious.
I'm here
Don't
for
try
it.
to take me to the goofy place.
I won't.
Okay. So this is a disturbing case, and it's also very near and dear to my heart as a psych nurse. Mm-hmm. So just prefacing this, this is going to be something that involves a psych nurse. Okay. So this is a case that happened very recently. The tragic event took place on October 28th, 2023. You guys know me in that I usually have my case done before, at least a week before. So imagine my surprise this morning, or I should say this afternoon, when I see that there was a breaking development in the case that I chose to do today.
Oh, perfect timing.
The timing is perfect, and I'm so glad that this woman's family is it's moving in this direction. You know what I mean?
Yeah.
So
I just want to contrast here. Dee is such a preparer, and here I am just flying by the seat of my pants every Wednesday. I study, if I'm lucky, the couple days before,
great job.
And then I'm like, I'm running out of time.
You know, it's interesting because if they listen to the podcast, they probably think it's the opposite. They probably think it's the opposite. They're like, oh my God.
No.
It's so interesting. When we were in high school, I would wake up at the butt crack of dawn to get ready for school. And that didn't take me so long. But this gal over here would wake up. We would have to be out of the house 7 o'clock at the latest. 7 o'clock to get to school on time. We only lived 10 minutes away from the high school. And every day we were late.
Every morning.
Because of this girl.
Every morning.
This girl.
You know what? I just really needed to absorb as much sleep as I could. I'm still like that to this day.
This last weekend. Risha, what, we're supposed to leave, Riz. We're supposed to go to the emergency room together, Riz. Thank God you came, because I was going to sleep. I was woken up. I was like, I can't make it up.
It always somehow works out.
Because I'm rushing you.
Dee comes and picks me up on Saturdays when we work together in the ER. And she always comes by. She pops in the house because she knows I sleep late. So she comes extra early to come arouse me from my sleep.
I usher you to the bathroom. I usher you. Come on, Riz. We're going to be late. But anyways, I digress. Because I'm not getting off topic today. We're going to talk about Joyce Grayson.
Okay.
She was a mother, a grandmother, and a wife who was a nurse for 36 years. Like, kudos to freaking her. She was amazing.
Yeah, I don't know how they do it.
Like, the nurses that have been nurses for decades. Like, it's just, it's incredible.
I know. I don't know how they do it. Here I am, 3 years in, burnt out. And there they are, 30 years, 40 years. Like, one of the charge nurses, she just, I don't know. She works almost every day. She does 12s.
Oh my God.
And she just is unstoppable, this woman.
They don't make them like that no more.
No.
Because I'll tell you, in 30 years from now, I'll be in my 60s. And I hope to be retired. It's a dream. It's like a pipe dream at this point, though. Like, am I really going to be able to retire?
No, we just need to wait for this podcast to take off. Wink, wink. And we'll be fine.
Okay. All right. I'm focused. Okay. So she was born in 1960 in Sterling, Connecticut, on a dairy farm with 12 siblings and her parents. She went on to graduate from Killingly High School and pursued higher education, her nursing education, at Windham Tech, where she got her license as a practical nurse. For 26 years, she was an LPN with the Connecticut Department of Mental Health and Addiction Services, aka DMIS. And she worked at various locations within DMIS.
Okay.
So, like, different facilities. She went on to retire from the state of Connecticut after 26 years. And then she began a new direction in her nursing legacy as a visiting nurse for Alara Caring for roughly 10 years.
But you know what? Let me just say, home health nurses, I don't know how they do it.
Yeah.
I don't know how they do that. A coworker and friend of mine she still does it, and I'm like, how the heck do you do home health?
I couldn't do it. Like, I wouldn't want to go in people's houses.
No.
I would no. I'm sorry. No. I'm not doing that. I don't, it's dangerous enough in a controlled, a controlled setting. You know what I mean? There's too many variables in people's houses.
And you never know what you're going to walk into. So, you know what? Kudos to all you home health nurses, because I could never.
You are some tough people.
Yeah.
You are tough. Like, I couldn't do it. I could not do it.
I've heard, like, horror stories about what they walk into.
This is a horror story, what happens to this poor woman. Her reward for the dedication to her patients and continuing to be a nurse even after retirement would be her death.
I can't believe she fulfilled all this time, retired, she then returned to do home health nursing.
She's amazing.
She just kept going.
She really was an amazing woman. Like, I'm going to give you more information about her as a person, and she's just lovely. Like, she was a lovely person all around. So she was only 63 years old when, again, she passed away on October 28th, 2023, after going missing while visiting her patient. His name is Michael Reese, and he was a convicted rapist. He was at that time living at a halfway house in Willimantic, so she went there to do the visit. After her visit, which was supposed to be only 8 minutes.
8 minutes?
Yeah, it's an 8-minute visit, I guess. It was, like, anticipated. I think she just had to, like, lay eyes on him. Check-in? Yeah.
Okay.
I don't think it was, like, anything more involved than that.
Okay.
But it specifically said 8 minutes. After she kind of went MIA, well, not kind of, she did go MIA after that visit, her phone's location was still traced at his address, and her family was super concerned. So fast forward a couple hours later, around 2 p.m. that same day, her family reported her missing, and the Willimantic PD went to do a search in the area. They found her car, and they were able to then trace her phone to Reese's address, where they found her body in the basement. So Reese, who again is a registered sex offender with a history of violence, was apprehended by the police while he was trying to flee the scene with a knife and debit cards that weren't his in his possession.
So are we thinking like it was an armed, or like he attacked her to steal from her and it just went badly?
They honestly, because this is, no charges have been brought against him. Mm-hmm. However, he has not been charged with her death yet. So there's still not as much information available because it's ongoing.
Okay.
But this is what I found. I mean, it does suggest if he had debit cards that weren't his. Mm-hmm. They didn't explicitly say that they were hers, but that's a logical, you know what I mean, assumption. Yeah. Okay. He was arrested on that same day that her body was found. However, it was for unrelated charges, including drug and larceny offenses, and as well as a probation violation. So the investigation is ongoing, and again, no charges have been filed against him for Joyce's death yet. The Willimantic police chief described what happened to Joyce as, quote, one of the worst cases that he encountered in his 27-year-long career in law enforcement. Following Joyce's death, the community really rallied around her family. And there's a GoFundMe that we are contributing to, so we're going to link it in this as well. Organized by her best friend, Jessie Bissett. On the GoFundMe, Jessie really highlights Joyce's exceptional dedication to her patients, emphasizing that nursing was really more than just a job to her. It was a profound commitment in which she provided love and care far beyond the call of duty. Mm-hmm. Reading it, she just sounds wonderful. She was married for 20 years to her husband, Ronald, and they were foster parents for DCF, the Department of Children and Families.
Oh, so that's such an important role.
Fostered so many kids.
Yeah.
The obituary goes on to say she treated her foster children as her own, even during brief stays, ensuring each child felt embraced as a part of her family.
Oh, see, that's such a beautiful role to have in these children's lives.
And you know, they say like the heart of the nurse, and I think Joyce really embodied that.
Yeah. Like
she did this for decades, and you know, it just goes above and beyond.
Yeah.
Like it's really, it spoke volumes.
And working as like a home health nurse, especially for psych, I feel like you takes a special kind of person to do that.
Absolutely. And I would never in 1,000 years do that. I do not have the heart of the nurse.
Yes, you do.
All right.
Yes, you do, you little nurse.
So according to her obituary, Joyce had a passion for cooking and baking, and she often was part of local bake sales and catering family events.
That's cute.
She was also very involved in her community. She volunteered all the time and would spend her summers camping and on the beach in Florida with her family. Joyce embodied a beautiful soul, dedicating her life to caring for others. Her role as a mental health nurse resonated deeply within her, and it was a true calling.
Aww.
So she is survived by her husband, Ronald, her 6 children, Elliot, Kyle, Caitlin, Evan, Audrey, and Sean, and she has 4 grandchildren.
Aww.
Claire, Jackson, Mia, and Tilly, and as well as her 11 siblings.
Oh my God.
So this just was like so freaking sad. It just also really like elicited an emotional response as well. Like, this poor woman, she's in her 60s. She's loved, she's involved, she's just like an exceptional person, and she gets freaking murdered.
And you know what? This case just goes to show how prevalent violence against nurses and other healthcare professionals is, because this can happen in any setting.
Mm-hmm. You know what, Ris? That's an excellent segue into the next part of this podcast.
Okay.
Because I came with facts,
I'm ready to hear that.
and we're about to go off.
Okay.
So, again, like Ris said, this really highlights that there is a need for stricter monitoring and oversight of any patient that has a violent history like Ris.
Yep.
He clearly was not safe for the community. So why are you going to send a nurse, one single nurse, one female
alone.
single nurse? So what, like, I can't swear on the podcast because I'll get edited out, but WTF.
It just like it seems like a disregard.
It is a disregard.
You know what I mean?
There's clearly we're disposable. They could have made sure that this woman was safe.
Yeah.
What are you doing? Because your priority should not be on patient satisfaction scores. It shouldn't be on anything besides making sure that your staff is safe every day. And you know what? The true motive is it costs too much money to send multiple nurses. Mm-hmm. It takes away from their profit. Mm-hmm. So what my solution would have been, send Joyce or another nurse, but with appropriate measures to ensure their protection. Mm-hmm. I understand that housing is difficult to find for patients. I get that. But the priority should be, oh, we're sending this person. We know that this person has a violent history. Let's send them with 2 security guards. Let's send them with whatever means to keep them freaking safe.
Yes, exactly. And you know what else is, yes, patient health and well-being is a priority, but that does not mean that the safety and well-being of the nurse or other healthcare professional should not be the priority as well.
Preach it, Ris.
In order to properly care for patients, you need to feel supported and safe.
Mm-hmm. But I was assaulted by a patient. I've been assaulted by a patient, and I was told, you can't press charges.
It's very normalized.
It's absolutely normalized. And you know what else? There needs to be a reform of not only the criminal justice system, but healthcare as a whole. Mm-hmm. Like, this is totally unacceptable. But, you know, we're just expected to take it on the chin and come in. Oh, you're assaulted by a patient? You're not pressing charges against them. What do you mean? It's become normalized. It's become part of the job. Yeah. You're going to be assaulted. You're going to be verbally, physically. I would even dare say, I know nurses that have been sexually assaulted, physically assaulted. It's par for the course, right? And this is absolutely unacceptable. And until nurses come together and say, you know what, I'm done, it's going to keep happening. Yeah. And we're a woman-dominated industry. Mm-hmm. We're being taken advantage of, and society needs to wake up. My other notes that I have. According to the International Council of Nurses, or the ICN, violence against nurses is a widespread phenomenon affecting nurses in multiple healthcare settings. Nurses experience various forms of violence, including verbal, physical, sexual harassment, and threats. Mm-hmm. Studies indicate that a significant proportion of nurses experience violence during their careers. For example, a study published in the Journal of Advanced Nursing found that over half of nurses surveyed had experienced verbal abuse, while more than 1/3 had encountered physical violence. What other industry is there that is the norm?
That's true.
What other industry? Mm-mm. I know no other. It's totally unacceptable. Mm-hmm. And again, it's a slippery freaking slope. I also want to mention that this violence has repercussions physically, emotionally, and psychologically for nurses. It can lead to physical injury, stress, anxiety, depression, and even PTSD, post-traumatic stress disorder. So not only are you sacrificing your nurse's health, you're creating more patients, which is ironic. This does not account for how many incidents of violence that go unreported. Nurses are fearful of retaliation, stigma, or they're just simply under the impression that this is part of the job.
Yeah. Or they're so overworked, they're like kind of turned off to it. You know what I mean?
Risk.
It's kind of like, okay, well, this person just, hit me, but like, I'm just going to move on. I have too much to do. I can't make an issue with this right now. You know what I mean?
That's listed as one of the risk factors, inadequate staffing levels.
That's true. It's so true.
They tell us to have empathy. Have empathy for your patients. Have empathy. Mm-hmm. And I'm not saying don't have empathy, but you also need to be that same love and affection and, devotion to your job you need to have towards yourself.
Exactly.
And protecting yourself.
Mm-hmm. I agree with you 100% that you need to, instill that same compassion for other people in yourself. Mm-hmm. Because, how many times you hear, oh, I held my urine for my entire shift. I didn't pee all day. I didn't drink anything. I didn't even, you know what I mean?
Yep.
And I've done it.
I've done it.
I've gone, we've all
Hours,
done it.
A shift.
And it's like,
it's normalized.
It's so normal. Mm-hmm. And it's not normal to not care for yourself because you just simply can't. Yep. You don't have the staff. You don't have the time. You know what I mean? Like, it's
unacceptable. Keep going.
That's all I have
Let
to
it
say.
out.
No, it's very frustrating when you like the other day I went to work and I was like, okay, because I'm trying to take better care of myself. And I went to work and I told myself in the morning, okay, you need to just take the time. You're going to be able to go pee. You're going to actually, eat your lunch. You're going to drink your entire jug of water today. You need to make. I was like, okay, I'm going to make like a thing of this. Patients can, as long as they're not, totally unstable, they can wait a second so I can pee. Mm-hmm. And, I could have somebody just look at my section for a minute. Like, I'm just going to do it because I need to do it this way. But I didn't end up doing it. I actually, held my urine and didn't eat anything. And I felt like crap when I came home. And I just thought, it's just like, it's very frustrating. That's all I have to say is I agree with you because we matter too. I mean, I know patients come in, they're sick, mm-hmm. We're trying to save them and help them. But our health and safety matters just as much as theirs does too.
Absolutely.
I mean, in the moment, obviously we're not actively, our life isn't threatened at the moment, but we can't take care of people the way we need to if we aren't taking care of ourselves.
Amen.
100%. And I tell all the nurses, I'm a pot calling the kettle black because I tell all the new nurses, the nursing students, I say, make sure you eat and you pee and you drink water all day. Make sure when you have to pee, you just go pee. Just do it. Mm-hmm. They're going to be fine. Just go. Because we just are keep pushing it off, keep pushing it off. And it's a toxic cycle.
It is a toxic cycle. And you know what, Ris? I'll tell you right now, when I was a brand new nurse, same freaking thing. Mm-hmm. I was getting to the point where I would restrict water to work this shift mm-hmm. so that I wouldn't have to freaking pee.
Yep.
And it's like, what twisted logic is that, man?
Usually I'm very good about it. I will eat, I will drink, I'll pee.
These are basic necessities. Yeah. This is, if our patients went the whole shift without peeing, we would be concerned.
Yes.
But why is it okay for us to go the whole shift without peeing?
Mm-hmm.
That's true. To do your best and be the best for your patients, you have to feel your best.
Yes, Mom. You're right.
You're right, Mom.
If you don't drink or eat and hold in your pee, you're going to have urinary infections. You need, just like a parent, a mom has to be her best to do her best for her children.
Yeah, right. And you know what else? It begs the question, would this still be the case if this is a male-dominated industry? Because as women, we're told, oh, you're a natural provider, you're a nurturer, you're blah, 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 blah. Mm-hmm. Who's nurturing me? Seriously, who's nurturing me? I'm definitely not nurturing me.
Me and my cats. When you come over, me and my cats nurture you.
But do you see how crazy it is? It's so crazy. And this whole mindset has set the stage for disasters like Joyce Grayson to happen. Because if we don't prioritize us, why would they prioritize us?
It's true.
And it's so disheartening, and we need to freaking do something.
I agree.
So, if you guys are on board, let's go do something.
Let's do it.
Let's do it. We implore anybody listening, take our safety seriously.
Yes. And pee and drink water. And, take a minute. If you are stressed and you're freaking out and you're anxious, take a minute and just breathe. That's what I do. I take a minute and I just sit in the med room. Well, I don't sit. I stand in the med room and I just deep breathe. It's okay. Everything's going to get done. I'm just going to keep my prioritization. I told one of the nursing students came in. She's like, how do you do this all day? And I said, let me tell you how I do it. I prioritize. Every little thing I do, I prioritize.
But it's so interesting that you use that language, prioritize, but you prioritize everything before yourself.
Yeah, that's so true.
And
you can't schedule a bathroom break in there in your prioritization. Okay, everything's done. I'm going to go. Can you just look at my patients? I'm going to go pee. Because I have had to pee for the past 6 hours. Mm-hmm. Just do it. Everyone's going to be okay. Just have one of your nurses. Just keep an eye. Run to the bathroom. I get people are really sick. People come in and they're really sick, especially, when I work in the ED and there's times I cannot get away. But just make an effort to take care of yourself, because that's really, really more important than we realize.
if anyone who can implement change is listening to this, so that's all the nurses or all healthcare workers, anybody who has a loved one in healthcare, these are some things that we could do. We can advocate for changes to be made in the healthcare system, such as implementing workplace violence prevention programs. And I'm not talking about the little block it, run away. No, I'm talking about this is how you really defend yourself. And I'm also talking about training nurses and other healthcare workers about conflict resolution, de-escalating these patients, and actually teaching them and trusting their instincts. If it's going south, listen to them. There needs to be improved security measures, and there needs to be a culture in which reporting and supporting these healthcare workers. If they file a report, allow them to file a police report. Support them in that. Don't villainize them. Don't discourage them. And there also needs to be policy changes in order to ensure healthcare worker safety. Essentially, take our safety seriously. And I just also want to say rest in peace to Joyce. You should be here with us advocating for this change. That's my spiel tonight.
Thank you, Dee. I'm glad you covered that case, because I've heard about that and I've been curious to cover it, but I'm glad you did.
I just want to give an update. Family is seeking damages from the employer. $160,000 fine. OSHA said that Alara Caring, the home healthcare agency she worked for, exposed home healthcare employees to workplace violence from patients who exhibited aggressive behavior and were known to pose a risk to others. Yet, get this, Alara had no harm prevention plan in place.
That's a no-no.
Reese strangled Joyce to death and struck her on the head and torso while attempting to rob and sexually assault her. He admitted to the crime in a phone call shortly afterwards. He said in the phone call, "I'm going to take the first offer they give me as long as the charges are right. I've already come to terms that this is it for me."
So he admitted to it.
Yeah.
Okay.
Well, that's absolutely horrendous.
This was an upsetting case, and you know what? Again, just goes to show how important it is to prioritize our own health and safety in these situations.
If you don't feel safe doing something, don't do it.
Yeah. And you know what? Then these hospitals wonder why it's so hard to retain staff. Because, and you know, the answer here is because a lot of these hospitals don't value us
Or
like they need to.
Home health care agencies either.
Yeah. Hospitals or other healthcare agencies.
It's terrible. Disgusting.
Well, thank you, Dee, for covering this case. And rest in peace, Joyce.
Rest in peace. And I hope her family gets the closure that they need.
Yeah, and I'm anxiously awaiting the trial, like to see what happens with that.
He admitted it.
Yeah, he admitted to it, so hopefully it's not.
And that came out 3 hours
see.
ago.
Yeah. All right, everyone. Do you want to call it?
Yeah, I'm going to call it. The time is 1937. That is 7:37 for all you non-military, non-medical folks. And just so you know, this is something that I feel really passionately about, in that we really need to advocate for change. This is not sustainable. And, you know, there is a camaraderie amongst nurses.
Yeah.
Like, and my heart breaks for her family that this happened.
Yeah.
No one deserves this, especially not someone as wonderful as Joyce was.
Yes. All right, everyone. We will see you next week for episode 40.
Wow.
That's 40.
Yep.
Our 1 year is coming up in late summer. So remember, make sure you take your bathroom breaks. Make sure you eat your peanut butter and jelly sandwich. Make sure that you drink your entire 50-ounce water jug, or however much your water jug is. And you know what?
And stay safe.
Stay safe. Put your chapstick on. And when you feel bad about a situation,
Don't do it.
don't do it.
Listen
And
to your
get
gut.
help. Always listen to your gut and stand up for yourself.
Yep.
Because, you know, you deserve to be prioritized too.
I could not have said it better myself.
All right, everyone. We're going to call it.
All right. Good night. You're killing it. Stay killing it.
Bye.
Bye.